Hi there, folks. I'm joining you from Edmonton with our Chief Medical Officer of Health, Dr. Deena Hinshaw, to take your questions for the next hour or so, in part about the Relaunch Phase 1 in Alberta's COVID-19 response. You may have seen our news conference a few hours back where we confirmed that Alberta will proceed tomorrow, May 14th, on the first phase of Relaunch, which is a reopening within public health orders of a number of businesses that had to be suspended and different kinds of activities. Let me begin by just reminding folks that, you know, how strongly Albertans have performed over the past 2 months. Thanks to your discipline and sacrifices, thanks to so many people respecting the safety and health of others, we've managed to perform very well as a province. Right now, we have about 70 people in hospital with COVID and about 11 in intensive care. And those are key numbers that we are following. And so we have succeeded in flattening the curve, and the credit goes to, again, millions of Albertans for that. And that's what's given us the confidence to proceed with this gradual, phased, prudent reopening. We've got to keep an eye on this, though. There are a number of places around the world that did reopen elements of their economy only to find significant spikes in infections and hospitalizations. And the problem with a virus like this is it's not gone until, well, there is a widespread infection rate well above what we've seen in Alberta, or widespread use of a vaccine that we don't yet have, or a treatment. So this is just the reality in which we are operating. And we are doing our very best with the best expert public health advice that we can get, and with the data to make the right decisions. And let me just say that here in Alberta, we've done much better than most other jurisdictions, but we continue to see areas of concern, primarily in Calgary and Brooks. You know, for example, across the province, we have 1,100 active cases, and nearly, 940 of those are in Calgary alone, versus 83 cases in the central Edmonton North regions. And that's why, on the advice of our public health experts, we have taken a bit of a regional or local approach for a slightly more gradual relaunch in Calgary. It's not a very significant difference. Retail operations will open within public health orders tomorrow, but things like hair salons and restaurants won't be reopening with limited service in Calgary and Brooks until May 24th, or is it 25th? 25th. And then there will be, we will be allowing limited worship services in places of worship across the province this weekend, with the exception of Calgary and Brooks. That will be on June the 1st. We'll post a link to all of the details in the comment section below. But before we start taking questions, did you want to start out with anything, Doctor?
I think just to echo what you said, and the thanks to Albertans, because this has been a long, hard road, and there have been sacrifices made to get us here. But I would just echo what you said, that the reason that we're here and that we can relaunch is because people have followed the guidance that we've offered, and that we've collectively achieved a very good, low rate of infection across the province. And just asking for patience for those in Calgary and Brooks as we do some more digging, do some extra testing, and watch really closely that sequenced approach in those places.
Well, thank you, Doctor. We'll go now to your questions, which is what this session is about. The first comes from Ashley Imison. And Ashley asks, have you considered segregating smaller boutique gyms from the larger rec center gyms and potentially have them open if they follow public health orders? Doctor?
Sure. So, you know, we are looking at the options as we've kind of laid out that stage 1, stage 2, stage 3. And gyms right now, I think, are in that stage 3 suite of different things that would open. But absolutely open to questions and suggestions from people, and there is a BizConnect's email address. So I think if there are certain sectors that are wanting to submit suggestions or wanting to say, here's how we think we can keep our patrons safe, then we can take that into consideration. And we do have to look at that within the context of everything that's being open, and then make kind of the best decisions for the whole. But please do submit suggestions to that BizConnect's email address for consideration.
Exactly. So I'd ask our team to please put the BizConnect email in the comment section below. They probably already have done that. And Ashley, what Dr. Hinshaw is really saying is that we are open, our public health folks are open to considering moving forward somewhat faster certain kinds of businesses or industries if we have received submissions about how that could be done safely to limit the spread. So I would encourage, in this case, we've heard a lot from so-called boutique gyms. I would encourage, I know there's not like one industry group that represents all of them, but I'd encourage boutique gyms maybe to find each other, get together and put together a joint proposal about how they think they could operate in a hygienic way, given the general guidelines for businesses that are available on the BizConnect website. Submit that on the BizConnect website, and our experts will take a look at that and perhaps consider advancing those particular businesses. Hussein Alimani says, are parks going to be open? Yes, Hussein, parks already are open. My understanding is that all municipal parks are already open, and we have announced already that starting last weekend, we reopened most provincial parks to vehicular traffic so people can actually get out there. And there will be a gradual phased reopening of the services in those parks. And I understand by June the 1st that campsites will be open with some distancing. We can't open every single site because of proximity, but there will be limited camp service and other services available. Bottom line is, yes, both municipal and provincial parks are open. Now, in terms of the national parks, the federal government has given indications they intend to keep those closed for most of the summer because they want to discourage interprovincial travel. But our Minister of Parks, Jason Nixon, is working with his federal counterpart to try to get a limited opening of Banff and Jasper and Wood Buffalo, our national parks, at least for Albertans to be able to go to those parks. So stay tuned on that front. Sherry, I don't have a last name, says, could you please talk about your plans for international travel? Doctor?
Sure. So I think at the moment, what we're doing is watching closely what's happening around the world. I think it's difficult to know what will happen over the next few months as different countries around the world are starting in a similar way to us to reopen businesses, reopen parts of their society. And at this point, I still recommend against non-essential travel outside the province, which obviously includes outside the country. I think that we'll just keep watching that, and it's very difficult to know when that recommendation will change because it really depends on the disease rates that we're seeing in other countries. And we know that our closest neighbor, the United States, depending on what state, there are still many places that are really struggling with their infection rates, and some states that have had real challenges with their relaunch experiences. So I think, again, that's just a wait and see. Unfortunately, I know we all want to be able to plan, and I wish that I could give more certainty, but it really is just a wait and see approach from my perspective. I don't know, Premier, if you'd add anything to that.
No, I agree. Look, here part of the problem is, for the foreseeable future, we need to maintain a self-isolation or quarantine requirement for people arriving from international travel. And that is the case, I think, in virtually every jurisdiction around the world. So if you fly to the US right now on essential travel purposes or anywhere in Europe, first of all, flights are extremely limited. Secondly, once you get there, you pretty much have to self-quarantine based on the local rules for between 10 and 14 days. So until governments across the world feel enough confidence to eliminate the self-quarantine rules, I believe that there's just not going to be a lot of demand for international travel. Gosh knows, I hope we can get back to that. You know, it's so sad that WestJet, great Alberta company, had just purchased a fleet of Dreamliners, and they were providing more and more international direct nonstop service to Alberta. That was a key part of our future tourism strategy, but obviously all of that has to be delayed for the time being. Christy Krasnowski says, how are you going to keep people from Calgary and Brooks from traveling to other municipalities to access services? Well, first of all, Christy, we're not going to keep people from traveling. We're trying to offer suggestions and recommendations. And Dr. Hinshaw earlier today did ask that folks in those two communities wait so they could receive services like haircutting in their own communities when those things are available 11 days from now. And the general recommendation is not to travel outside your own region unless it's essential. But we recognize that people have second homes and cottages, and if they go to those places, that's perfectly legal. And we just ask that people, follow common sense. If you have got a cottage in Sylvan Lake or a second home in Canmore or something like that, just, stock up on your grocery supplies before going out there so you don't have to mix and mingle too much. And secondly, if you really desperately need a haircut, we would suggest you wait an extra 10 days. Lord knows I need one. But do you want to comment any further on that, Doctor?
I think, again, just to echo what you said about the fact that people who live in Calgary and Brooks, there are lots of people who live in those places, and not everyone who lives there has been exposed or is infectious. Yeah. So what we're doing by having this slower staged approach in those places is just having less opportunities for people to be within close range of each other. So some of the things that we've limited, things like restaurants and bars, haircuts, and worship services are really places where it's more challenging to keep that 2 meters of distance. In some places like a hairdresser's shop, you literally can't because you're there for that haircut. And again, as mentioned, we have made that suggestion that people in those places do wait for that 10-day period and then access those services in their own communities. However, that's not a legal requirement. It's just a suggestion. And so really ask that people not treat those who live in Brooks or Calgary as if they are somehow dangerous to others. That recommendation, again, is just made because we're wanting to keep people from non-essential travel in regions throughout the province and wanting to make sure that we are cautious throughout this first 10-day period of our reopening, but really need to be compassionate with each other and kind as we learn together through this relaunch phase.
And just a reminder, in this first phase, retail services can open within the public guidelines, which basically means trying to limit the number of avoiding crowds in stores, making sure things are cleaned, and follow the public health guidelines. So retail, including shopping malls, will be open in Calgary and Brooks. Secondly, restaurants that operate outside of the city, like whatever in Canmore or Airdrie or Strathmore, they can only seat at 50% of capacity anyway. And so I think there's a limitation that, people can't just flood out of the city for those services, practically speaking. All right, the next question goes to Christy Krasnowski, who says, how are you going to keep people? Oh, I just did that. I'm sorry, Christy, pardon me. Diana Elias says 2 questions. How many people are allowed to meet in places of worship, and how does it work with the number of people allowed in shopping centers? Doctor? Sure.
So the guidelines that we've put together for places of worship as our stage 1 of opening is that a place of worship can have 1/3 of their normal worship size. So that's not the total congregation, but the number of people who typically would attend worship service, 1/3 of that number, or 50 people, whichever is smaller. And we are taking a cautious approach to worship services in this first stage of relaunch because we have had several instances where we've had significant outbreaks linked to a worship service or a particular kind of faith community gathering. And so there are certain things that are challenging about people gathering in a space where, that is a place where people support each other, where people want to be together in person. And we want to allow that, but we also want to be cautious about it. So in this first stage, we're limiting those numbers. We haven't limited the total number of people in a shopping center or the total number of people in a retail store. What we're doing in those places is requiring that 2 meters of distance. And that's partly because people go into shopping centers or a retail store for a very different purpose than attending a worship service. So a worship service is a community of people. And as a community of people coming together for a particular purpose, they're coming together, they're seated together for a duration of time. And there will be a natural tendency, especially after having been apart for so long, the natural tendency will be to want to greet each other, to want to interact with each other. And we're setting that number limit to help all of us as we ease back into relaunch, as a reminder that we do need to stay distant from each other, even in that context of a community of people who will be excited to see each other after a long period of absence. And that is very different from a shopping center where people are there for a particular purpose. They're not there for social purposes, and they're there to go and purchase something and then leave again. And that's the reason for the discrepancy.
Thank you, Doctor. So the next question comes from Cindy Kim. Why aren't daycares reopening? Well, I think we have permitted daycares to reopen within certain guidelines.
Yes, absolutely. Daycares are opening, or daycares, I should say, are permitted to open across the province. So there's no restrictions on daycares being allowed to open in Calgary or Brooks. What the limits are is there are limits to the number of children and staff who can be in a particular cohort. So we have required daycares that are going to be opening to limit their cohorts of children to 10. So that includes staff and children. And the reason for that is, especially with young children, it's just not possible to keep them 2 meters apart for an entire day. And so we're using a cohort model to try to keep the number of children who are going to be close together low, and that those cohorts are going to be kept separate from each other during the day. So there are some limitations. There's quite detailed guidance on safe operations of daycares, and that guidance is posted on our website. But daycares, again, across the province are allowed to open. There may be specific daycares who are choosing to wait or choosing to not open for very specific business reasons, but they are permitted to open.
All right, so Karen Johnson Diamond asks, has the Alberta Trace Together app alerted you to cases that you would not have detected without it? Just context for folks who are not aware. The AB Trace Together app is a voluntary app that we have, Government of Alberta has put out there. It's been used in other countries, where you can download it on your smartphone, and if you enable it, and it will, and when you're out and about, it can identify and store contact information of people you've been in the proximity to for at least 15 minutes. And then subsequently, if you get sick with COVID and you go to the hospital, let's say, and they begin tracing because they want to know who have you been close to, they can just download, they can use a code, a key, to download the data, and then they find out automatically everybody who you've spent 15 minutes within a close proximity over the recent past. Similarly, if you've been out and about shopping or something, and somebody that you know have been close to is confirmed positive with COVID, and they've got the Alberta Trace Together app, then they can get the key downloaded, and then you'll be contacted saying, hey, somebody you were with 3 days ago or whatever has tested positive. So it's a way of almost automating the tracing and tracking, which is a key part of preventing outbreaks. So we offered this to Albertans about 2 weeks ago. I'd like to ask our team to put a link in the comment section for the AB Trace Together app. I think about 10% of the population have downloaded that, which is a good start. We'd like to see the number higher. I don't know if it's been used yet. Do you?
It's a good question, and we did get this question, I think it was late last week, from media, and I think at that point, Alberta Health Services, because the way that the key is used, as the Premier mentioned, is that the contact tracers who work for Alberta Health Services, when there is a positive case of COVID, if the person who tests positive has the app on their phone, then they're asked if they give permission for access to that string of individually non-identifiable keys that would identify the people that they had been close to. And if they give permission, then that list can be uploaded to the contact tracers. And as of late last week, they had not had an opportunity to use it yet. And I actually haven't checked with them this week. So that's something that maybe we can do. And I know that that's been something, again, that we've been asked about in media. So we'll ask that, and then I'll make sure that proactively that's in my comments at some point this week so that people know how that's being used and if that app has been able to detect cases or close contacts that we otherwise would have had a hard time finding. So I'll make sure to get that information.
Yeah, the app is not a silver bullet, especially if only a relatively small number of people download it. But folks, please understand, if you're keen to get as things back to something like normal as quickly as possible, one way you can help do that is downloading the app, because then when there are positive cases, when there are outbreaks, we can much more quickly identify the people who have been in connection with that individual, and then contain them in terms of encouraging their self-isolation and so forth. So this is this is a smarter, more efficient approach than having our public health officers spend hundreds of hours on the phone trying manually to track down everybody that somebody who's tested positive may have been in contact with in recent weeks. So this is not Big Brother, it's not government intrusion. It is a voluntary app that helps to speed up the tracing and tracking process, which gives us greater confidence to reopen. All right, Tracy Matson asks, why do you keep comparing Alberta to heavily populated areas? Our hospitals are empty. Well then, Tracy, thank you for the question. First of all, they're not completely empty. We do have, first of all, about 8,400 acute care beds in the province. And I think about 6,000 of those have non-COVID patients occupying those beds. So the hospitals continue to function. We have set aside a couple of thousand, about 2,300 acute care beds for COVID patients. And you're right that there's a relatively small number, only 70 in those beds. That's a good problem to have. When I compare us to more populated areas, I'm not sure that I've done that here tonight. What I can say is this, that we have seen in other jurisdictions, this pandemic rip through those areas like a rampage and take a lot of lives. And so we cannot ignore the threat that this poses to human life or the threat that it poses to overwhelming the healthcare system. We've done very well, but these things can take off very fast. And Doctor, do you want to speak more to that?
Sure, and I think perhaps that's a reference to sometimes we talk about New York or we talk about Italy and the experiences that they've had with being overwhelmed. But I would say, I know I've also heard people talk about Sweden and quite admiring Sweden's approach, that they took a more advice-driven approach to asking people to stay away from others. And what I would say to that is that the last time I checked the death rate in Sweden, it was 10 to 12 times higher than the death rate in Alberta. And Sweden is not a densely populated country and could potentially be seen as somewhat comparable to Alberta. So what I would say is that in other jurisdictions where there hasn't been the stricter approach, in some places like Italy, like New York, that are more densely populated, they saw an overwhelming rush in hospitals. In other places like Sweden, they didn't have that same overwhelming surge in their hospitals, but they have seen significantly more death in their population than we have. And so it comes back to wanting to do the best we can for our population and putting the measures in place that have been put in place across the country in order to keep our numbers low. And really it's because of the efforts of Albertans that we have not had to use all 2,300 COVID hospital beds or the extra ventilators that we had stocked up just in case. And so that is a success story, I would say, that we have prevented deaths with what we've done.
Thank you. Jason Pearson asks, what exactly do you think will change between now and 11 days from now? Do you at least hear the anger directed at you? Well, Jason, I've heard a lot of anger over the past 2 months, anger directed in every direction. All you have to do is look at the comments section. You're going to see some people saying, or who are angry that we're moving forward with the relaunch because they think we're taking too much risk. Other people angry that we're not opening everything all at once. And so we cannot allow, I cannot as Premier Jason, allow myself or the government to be directed by anger and sentiment and emotions. Those emotions are totally legit. I'm angry. I'm angry that our economy has been absolutely hammered, and we've lost over 100 lives, and hundreds of thousands of people have been put out of work, and some people have lost their life savings because of this whole situation. I'm frankly very angry about that. But that anger is not a solution. We have to be cool-headed about how we address this. And here's the bottom line, Jason. As I said in my TV address a month ago, if we just if we do what, like, some days I wake up in the morning and I say, oh, we only got 70, 80 people in hospital. What's the big deal? Why don't we just pull off all these restrictions and just trust people to act responsibly? I know that's appealing to many folks. Sometimes it's appealing idea to me. But if we did that and we let the virus run loose, then inevitably we're going to end up with a huge spike in cases, and then it's going to build up in the hospitals. We'll have more Albertans dying of this thing, and we'd have to come in and step in with far more stringent measures. We've tried, Jason, to be very surgical and careful about this. So 85% of the businesses in Alberta have been able to continue operating during the COVID period, and they represent about 88% of the workforce and about 96% of the economy. Now, that's no solace, that's no comfort to the 15% of businesses that have had to suspend operations for the past few weeks. And they have a right to be angry. But they would be even more angry if we reopened prematurely. That invited a spike, and then we had to clamp down on things even more severely, like most jurisdictions have done. Doctor, would you like to add?
Sure. I mean, I guess I would say that and personally, when I was working through the recommendations that I was going to bring forward to the Emergency Management Cabinet Committee, I did not take any of those lightly. And I recognize that these restrictions have caused suffering for Albertans. And I recognize that a delay in opening continues to cause hardship for people. What I also know is that other jurisdictions around the world who have opened quickly have seen problems. And even a place like Singapore, which a few months ago we were talking about as an example that we would want to emulate, they had some significant issues with the introduction of virus in a particular portion of the population. And they ended up, after actually having successfully contained it without a significant lockdown, for many weeks, they ended up having to move into a lockdown. I looked at a case study that my team presented with respect to the experience of Alabama, where after having been in lockdown, they opened their restrictions on retail. And within 7 days of opening their restrictions on retail, they had the highest daily case count that they'd ever had. And so from my perspective, when I see the active cases in Calgary and Brooks, and the number of cases that we're not sure where they came from, we don't have a known source, I'm concerned about community spread, and I'm concerned that if we opened everything in stage 1 in those communities, that within a week to 10 days, we could see that same thing happening. And I know that many people, in fact, most people who get the virus will recover and won't need healthcare, but some of them will die. And so again, going back to the Sweden example, we have to choose how we approach this, and every choice comes with a cost. Some choices, the cost is more deaths, and some choices, the cost is more financial hardship. And we can't get out of this without making a choice between very difficult outcomes. So absolutely, I hear the anger, and absolutely, I hear the frustration of people who just want to get back to their normal lives. And if I had the power to give people their normal lives back, I would do it tomorrow. But it's my responsibility to make the best recommendations I can to prevent the possibility that reopening could cause us to have a significant spike that would be harder to control. And maybe just to say the 11-day piece.
Yeah, I was going to say that's an important question.
Yeah, because the 11-day piece isn't about something, changing necessarily the businesses, between tomorrow and 11 days from now will be safer. What the 11 days allows us is to watch the impact of the first part of reopening, because again, all retail, daycares, and museums, art galleries, sort of some of those places where people haven't been able to go to for a while. All of that's opening. All retail is opening in Calgary and Brooks. And the 11 days will help us to see if we have a significant increase in cases or if we can manage to keep a steady state. And then we can be more confident moving into those businesses where people will be closer together, like restaurants, bars, and hairstylists.
All right, but thank you for the question, Jason, and thank you for the point. Peter Spears says, who makes these rules and stages? Well, broadly, the government of Alberta does, Peter. We do so on the advice of the Department of Health, which with input from the Chief Medical Officer and her public health team. Ultimately, all of that advice goes to something called the Cabinet Emergency Management Committee, which has been meeting nonstop really throughout the crisis. And we look at those recommendations and we have to balance things off, Peter. I mean, Dr. Hinshaw's job is to be focused on the public health implications of everything we do, on saving lives, the bottom line. The cabinet also has to look at broader social and economic considerations. And I want to thank Dr. Hinshaw for having been sensitive to those broader interests. None of these are easy decisions to make. You know, a lot of us who are on the elected side of this, well, I'll be honest, our bias would be to go fast and reopen more things more quickly because we see the pain in the economy, and that pain has health implications, mental health, emotional health, family well-being, and ultimately physiological health, as well as affected by all of those factors, by people who are facing enormous financial stress. At the same time, we have to take on board the data-based scientific advice that we get from our public health experts, and we have to come to a balanced position. And I would say to Peter and to Jason, who asked the question before you, we're not the only ones doing this. I mean, every place in the world is having to balance these things off. And we're all taking slightly different approaches, but generally speaking, from Japan to Germany, countries have adopted very similar policies to try to balance these things. So there's no template, there's no simple cut and paste policy approach. We're looking at the specific numbers and conditions here in Alberta. That's what we weigh out at the Cabinet Emergency Management Committee. And Peter, you know, I just want to say, it's not something I ever signed up for. I mean, Dr. Hinshaw, as a public health expert, has been researching these issues for years. I got elected on a mandate to grow the economy, not to suspend the operation of any businesses. This has not come naturally to us as a cabinet, but we've come to the same conclusion that virtually every country, every jurisdiction on the face of the earth has come to, which is that this is an unknown virus with a very high attack rate, a very high mortality rate compared to other similar viruses in the past. And it has the potential, as we saw in Spain and Italy, and to some extent places like New York, to completely overrun a healthcare system. And that's not something that we could permit to happen. So do you have anything to comment on that?
I think that covers it.
Sheldon Andreas says, will people be arrested or ticketed for going against the recommendations?
So there are certain things that there still can be tickets issued for.
Maybe we should make no, that's all right. Maybe we should just make a distinction here. I think the simple answer to that question is no. Not again. There are recommendations, and then there are public health orders.
Right.
So, for example, Dr. Hinshaw is recommended against non-essential travel outside your region. But if you're a Calgarian and you go safely to your holiday home in Sylvan Lake, no one's going to arrest you or ticket you. But then there are public health orders. So if you arrange a party, a block party, and you invite 1,000 of your closest friends, and you're all in close proximity, yeah, you might get a ticket, and some people might be detained if they're doing completely stupid things. So public health orders versus recommendations. No one's going to get fined or punished on a recommendation. And that, I think that's a good way of.
Yeah, no, I think that's an important distinction to make because, for example, the recommendations that we have, as you mentioned about not traveling for non-essential purposes, and some of the things that we've talked about. So, for example, wearing a mask when you're within 2 meters. Those are recommendations. That's not an order. Again, that's something that's fairly simple that most people can do that helps us limit our attack rates, but no one's going to give you a ticket if you're not wearing a mask. Having said that, the recommendations really are in place to help people understand what the things are that we can all do together to help protect each other. And so we would always encourage people to follow the recommendations, but the recommendations are not something that you could be ticketed for. However, if there is someone, so for example, someone who owns a nail salon that's not in stage 1 and they are wanting to open that nail salon, then it is possible if they open and they have customers in and they're serving customers in a business that isn't a part of the relaunch, then those people could receive a ticket for violating the order, which, as you say, that's the distinction between the order and the recommendation.
Now, Doctor, I think people could reasonably be a little confused between the two categories of a recommendation versus an order. And so if you want clarity on that, go to our Alberta COVID/19 or -19 /19 website, and all of the public health orders are actually there. Those are the ones that have the force of law. Now, even within that, let me say this. We expect law enforcement to apply those orders with a heavy dose of Alberta common sense. And I'm going to speak to a particular circumstance. So here at the legislature on the weekend, but let me just back up and say, in recent weeks, there have been some protests in front of the ledge of people who wanted to speak out against some of these public health orders. And in so doing, they are absolutely using the constitutionally protected freedom of speech and freedom of assembly or freedom of association. But they were doing so, I think, generally I gather, in a safe and respectful way, keeping their distance. There were small family groups, but otherwise people were keeping that 2 meter distance. And I think they were trying to be responsible about that. We thank them for it. Nobody had been arrested until this past, I think, Sunday. And one gentleman was arrested, and in part because he refused to give his identification at a small protest in front of the ledge. Well, look here, here's my view. If you had 100 people in front of the legislature, 6 or 10 feet apart from one another, and they're eating lunch or they're reading a book, nobody's going to come along and ticket them. And so if they happen to be there with a sign or a slogan, or they're hollering messages at the building to get across to me and Dr. Hinshaw, you know what? I don't think that we should be treated differently. I'm not here to criticize our law enforcement folks. They've got a tough job to do at the best of times. So right now we're in a totally different world. I think they're trying to respect these public health orders, which prevent public gatherings of larger than 15 people. But we're just asking our law enforcement officers to apply that with a heavy dose of common sense while respecting the freedoms of speech and assembly. And not everybody's going to get the right answer to these tensions every day, but if necessary, we will modify the public health orders to demonstrate, to be clear that people can gather as long as they're separated in an open public space. If they're trying to send a message, as long as they don't congregate more closely together. All right, Steve McDowell says, are you concerned about the amount of food being wasted in Calgary by pulling the plug on restaurants at the last minute? Steve, first of all, very sorry if there is any food being wasted or restaurants went ahead and ordered. We did try to make it very clear that May 14th for phase 1 was a target and not a final decision, that it would depend on the data and the final recommendations that we received. And so I'm sorry if any restaurant owners went ahead and ordered supplies in that period. And our advice would be that they could use this period to use those supplies for takeout service. If they're planning to ramp up for a limited in-service dining, then moving into takeout would be a smart initial phase, I think. Get their kitchen staff working, and so we hope people will do that. In most cases, a lot of the materials would be dry goods or stuff that they can freeze and refrigerate. And of course, I know our food banks would always welcome any additional supplies.
Yeah, and I would really encourage Calgarians who are wanting to support the local economy and support local restaurants to consider ordering takeout to support those restaurants who did stock up. I would echo the comments from the Premier that I am sorry for restaurants who have had this investment and now this change that we announced, although the challenge that we have is we need to have the best possible data to make decisions and to make sure that we're making decisions with the information that's not a week old, but that's current. And so unfortunately, what that meant was this ability to let people know was only just that one day before. But I want to assure those in Calgary that the May 25th target date that we're looking at, that's something that we're very focused on, and we'll be able to provide information to the public and to Emergency Management Cabinet Committee as we monitor the spread of the virus over the next 7 days, so that there will be more advance notice before the 25th.
Doctor and I talked about this earlier today. We really regret the short notice on the final decision. We're doing everything in real time here, trying to get as much data as we can. And in fact, that decision wasn't made until late last night. We had to work out more details today before the announcement. And so we want to prevent that situation in the future. Next time we come up to a date like May 25, we'll be sure to make the decision at least about 72 hours beforehand to give people a bit more notice. Mm-hmm. Thank you for that. Adam Finlay says, so Calgary's closed, but Airdrie, Cochrane, and other outskirts are open for all of Calgary to come to. Why not close the zone or open it all so it's fair to all communities? I guess part of the answer to that, Adam, is where do you draw the line? Because there's outskirts and then there's further outskirts. The fact of the matter is very simply this: 3/4 of the active cases are in Calgary, and there's not a huge difference. I think there might be in everybody's minds, including my own, frankly, a tendency to exaggerate the difference of the phased relaunch. Retail opens in Calgary tomorrow, they can. A lot of other services get to open in Calgary tomorrow, and Brooks. We're only really talking here about a few things like hair salons, sit-down restaurant service at 50% capacity, and worship services. Those are the main things that are 10 to 14 days later.
Mm-hmm. Yeah, no, and again, I think that sums it up, that to be able to know that line drawing specificity is very challenging, and we did focus on the area that again has the highest cases, which is Calgary. Right.
If we started choosing communities outside of Calgary, then you're into a whole other line drawing exercise. Does that include Canmore? Does it include I don't know how far outside of the city do you go? So these municipal boundaries are what made, I think, the most sense in terms of the decision that was made. Glenn Biswinger says, are masks going to be compulsory? Well, not at this time. We are strongly recommending the use of face coverings or masks if people are going into areas where they cannot be more than 2 meters away from others. I would strongly recommend masks in contexts like mass transit, LRTs and buses, for example, or crowded venues. Doctor?
Yeah, I think that covers it.
But at this point, not a requirement. And I would like to add, Glenn, that the government of Alberta has ordered 40 million non-surgical masks that we intend to distribute to Albertans so that everybody will have access to at least a minimum number of masks for times when they will be going into situations like that. And people are welcome to develop their own cloth masks, for example, and there's a lot of great community groups who've been doing just that. Lurie Schaefer says, where is the list of recommendations and orders? Larry, they are on the Alberta COVID/19 website. And if you look at the comment section below, I'm sure our folks have posted a link to it right there.
And maybe just to add that the reopening order will be posted tomorrow. So I know that people would want to see that today. And unfortunately that we're not going to be able to post that until tomorrow. So just so people are aware that the orders that are on there are all of the orders that have been issued up till now.
Although there is a news release that summarizes the
That's true.
content.
So the news release is available that summarizes the content, but the actual the specific order for the relaunch will be available tomorrow.
Jilliana Elizabeth asks, is there a reason the restrictions are so tight on religious gatherings?
So we've seen both here and in other provinces and in other countries that religious gatherings can pose a particular risk of what's called a super spreader event, where you have a small number, one or maybe a couple of people who are infectious who attend a gathering, and then that one gathering results in many, many cases. And so several, I think it was last week, actually, I shared a story that I had been given permission to share from a church group that had a gathering in mid-March before we had done most of our public health orders. So they did nothing wrong. And in fact, they had been working very hard to observe the 2-meter distancing rule, to have hand sanitizer, to have only one person who was serving food and drink at a small gathering that they had. And unfortunately, of the 41 people who were there that day, 24 people became ill with COVID and 2 people died. And so for many religious communities, there are many members of those communities who are in risk categories, such as being older. We also know that when people gather together in religious communities, there are certain things that we tend to do, such as singing together. In many, many religious contexts, that's a common activity. Singing is one of the things that can spread the virus very efficiently. There was just a report in the Communicable Disease Control in the United States about a choir practice where they had a choir practice, and then after that fact, many of the members of that choir ended up getting COVID. I believe it was around 60, and there were again a couple of deaths in that choir. So with the restrictions that we currently have in place for places of worship, it's intended to make sure that we have a relatively small number of people gathering together, and also that some of the riskier practices, such as singing in groups, that it's very clear that that activity is a high-risk activity, and so is something that communities can not do together to protect each other. And again, I think that the important message that I want to get across is that the reason for the guidelines, the reason for the restrictions is because we want to make sure Albertans know how to protect each other, how to protect your families, how to protect yourselves, how to protect your friends and neighbors. Because without that information, without that guidance, it's difficult to know what are the things that are risky and what are the things that are safer. And so the reasons for those restrictions on religious gatherings are because those gatherings can be a risk of transmission, and the things that are in place will make those gatherings safer. And as we see how this relaunch unfolds, there may be the potential to ease those restrictions somewhat. But for a first step, that is what we're wanting to do, is make sure that those gatherings have those instructions to make sure that they know how to take care of each other.
And let me just add that, I'll be a little more blunt. At the very beginning of the pandemic, there was a prayer meeting, a religious gathering, from which we can trace probably most, if not all, of the infections at the Mackenzie Town long-term care facility, as well as a connection to Cargill. And so that just shows you what the doctor calls a super spreader event. You can get multiple massive outbreaks and a significant number of deaths from one gathering. That's the experience that's the experience around the world, and that's the experience we've had. Look, my whole life, I've been a huge champion of religious freedom. And the notion of restricting freedom of worship, to me, or limiting freedom of worship is completely counterintuitive to everything I believe. At the same time, I want to thank faith communities of all traditions for having acted so responsibly during this difficult time. And we are not impairing the ability of people to worship. They can do so obviously in the Christian tradition, there's this idea of the domestic church, of people worshiping at home. And every faith tradition, I believe, has that. People can worship online together collectively. And as we move to the relaunch here, starting this weekend, starting tomorrow, small gatherings are permitted according to the public health orders. And let me also say, this is true, I think, it is true in every jurisdiction in the world. People talk about Sweden as though it's live and let live. They've had a maximum of 50 people in public gatherings, including in worship services. We have a maximum of 15. If we continue to do well, and people take personal responsibility for each other's health, then I expect we will get up to that 50 number at some point soon. Or I should say, I shouldn't put a timeline on it, but I'm hoping we'll get back up to 50. We do in worship services.
Yeah, in worship services, yeah.
Yeah. So here's my point. Sweden is the outlier in the whole world. And yet they have a maximum cap on 50, and we're going to 50 on worship services. So I would just say, I don't like any of this. I particularly don't like that restriction. But Doctor started out that answer by quoting a pastor who called her up to say, we had congregants die following a worship service that we had where we followed all of the hygiene rules, and please pass that message on. Anyway, we better move on. We spent a lot of time on that one. Sebastian LeBlanc says, are you going to do serological testing in Brooks? It would be nice to know how many were infected and didn't know. Great question, Sebastian. Short answer is no, not yet, but we will be ramping up non-serologic testing over the days to come. I agree totally with the premise of your question, Sebastian, that large-scale testing is critically important where there have been outbreaks, and Brooks is certainly such a place. We did, the Alberta Health Services South Zone did set up a special testing center, and I think about 3,000 people did get tested in Brooks on that first round, and we'll be setting that up again. And I've been a strong advocate, our government's been a strong advocate for using serologic tests. For those that don't know, that's a kind of like it's a blood test that can detect whether the antibodies of a particular disease, you have those antibodies. It tells you more about whether you may have contracted the disease in the past than whether you are currently asymptomatic. The problem is that Health Canada only last night did they approve the first serologic test in Canada. Good news is this, AHS has been doing their own small trials on, I think, about 15 different sets of serologic tests to see what might work. And as soon as we get confidence about the reliability of an approved serologic test, we intend to make that an important part of Alberta's expanded testing strategy. Would you like to comment further?
Yeah, absolutely. And so I think, as you said, the importance of serology is to help us understand that population infection rate, kind of looking in the rearview mirror. So it doesn't help us, at this point in time, the tests that are available don't help us diagnose active infections. And so we are working to set up the process about who would be eligible for those kinds of serologic testing. But it is also important to know that the information is not going to be particularly useful clinically. So it doesn't necessarily tell us, for example, for sure if someone is immune or not. There's that question of, do we know for sure if someone who's been infected is then immune from further exposure? And there's certainly good reason to think that that's likely, but we don't know that for sure. And we also don't know if the testing that we have that's coming online can detect the protective levels of antibodies. So there's lots of unknowns still, but we are planning our approach to who will be included in some of that population testing. And so there will be more information coming in the coming weeks on that.
Paul Chandler asks, are we going to be the next Germany? They open early and have 3 times the cases now. I didn't know that. I do know there have been some concerns, but doctor, do you know about the Germany situation?
Well, I think what I would say is that the reason that we are having our reopening staged the way that it is to avoid having the experience of Germany.
Or Hokkaido, for example.
Or places like I mentioned earlier, Alabama. So
Yeah.
It's not, again, to say that, we're all learning in this, because this is an event that is new for all of us in our lifetimes. And so we're all learning through this. We're looking at Germany, we're looking at the states that have opened, we're looking at Japan, and we're trying to learn lessons so that we don't repeat experiences where reopening caused a huge spike. And that's exactly why we've taken the approach that we have with some regional phasing, as well as the staged approach across the province. So again, the whole purpose of our relaunch plan is to avoid having a sudden surge in cases.
Elizabeth Clammer asks, you've recommended that families can have one cohort family that they can safely partner with. Will the government of Alberta be providing guidelines to expand a closed circle at some point to, say, 3 or 4 families?
So it's a good question. I've had it before. I think what we're wanting to see is how the first stage of relaunch goes. We'll watch our experience over the coming weeks and see if we're able to maintain that level. I know that families, especially families with children, but I've also heard from people who are single and living alone, that having the ability to be together with people and not have to worry about that 2-meter distance all the time is something that we're all yearning for. And so I think once we work through this first stage, we see how this goes the first few weeks, then considering that expanded cohort is definitely something that's on the table. But we want to make sure that we're not expanding people's connections with multiple other people all at once. So, as my colleague from BC, Bonnie Henry, put it eloquently on a recent conversation, a recent meeting that we had, she said there's really 2 things that are important. The first is the number of people that you have close contact with. We're trying to keep that low. And the second is when you do have close contact with people outside of a small number that are in your cohort, you make sure that contact happens in a safe way. So whether there's a physical barrier like plexiglass between a shop person and a customer, or whether that masking can help with reducing the risk. So really those are the 2 things as people are considering this relaunch, what should I do? You limit the number of close contacts, and you make sure that the close contacts you do have outside of your cohort, that you're engaging in a way that's as safe as possible.
I see Sherry Smith asking, with stage 2 hopefully coming soon, will this allow graduations to take place? And Ruhi Latif asks, when is stage 2 coming? And Sunny Serene says, what would be the best case scenario for stage 2 and 3? So why don't we take those together?
Sure. So right now, the date that we're targeting or looking at for stage 2 would be June 19th. Similar to the date that we had for stage 1, that is dependent on how we do in stage 1. And the better we do in stage 1, the more likely it is we can hit the June 19th target for stage 2. And if we're seeing that our infection rates are stable and our hospitalization rates are stable and we're not seeing a sudden surge in cases, then that would be the date that we're aiming for. With respect to graduations, we actually were just having this conversation today because there have been questions about drive-in graduations, as some places in the States have had the kind of alternate graduation ceremonies that have allowed people to stay distant from each other. And so the question of whether or not that would be allowed, or what other types of gatherings might permit a graduation ceremony to take place. And so we're looking at those questions and absolutely recognize that graduation for high school, graduation from university is a significant event in someone's life. And we want to think about ways that we might be able to enable that, but without having a large group of people gathering close together, as would be a concern for COVID transmission or for a super spreader event. So again, we will be releasing more information very soon on that.
And on the timing, the advice we received from public health, is that we should not proceed with stage 2 prior to June 19. This would be to give our public health experts about a month to assess the data emerging from phase 1. This comes back to an earlier question from, I think, Paul, about Germany opened and they saw a surge of new cases. We've seen this in Hokkaido, Japan, which is Alberta's sister province over there. We've seen it in a number of jurisdictions around the world. And as I've said before, really the worst case scenario is we end up giving people whiplash, opening, closing, opening, closing. It's much better to go on a gradual reopen pathway. And that means we've got to give our public health folks the chance to see the data, the impact of each stage. And ultimately depends on everybody acting responsibly. Sophie Ellen says, why are massage therapists part of phase 2 when hairdressers are okay to work in phase 1?
And then I think there's a second question.
Why can chiropractic care reopen but not massage therapists? Yeah.
Mm-hmm. So the rationale for the second is that when we looked at the different places that were closed, we looked at those professions that have a health professional college, so those that are regulated under the Health Professions Act, that have a responsible college that oversees the actions of their members and make sure that they follow a standard of care and a code of conduct. And so those professions that are under that Health Professions Act, which includes chiropractors, those were allowed to open in this early stage. And in fact, even prior to stage 1, some of those places that have been able to put in place measures that align with our healthcare workplace guidance have been allowed to open already. And that's again because they have colleges that oversee them. There's a responsible body that's able to monitor and ensure that their members are following up with the appropriate guidance. With respect to hairdressers and the difference between a hairdresser and a massage therapist, the decisions about which, and so massage therapists fall into the category of personal services. And when we look at, there's multiple different personal services that can be offered, things like nail salons, things like tattooing, massage therapy. And so looking at the differences between the personal services, the hairstyling and barbers, there was a consideration of the fact that there is an infection control module that hairstylists go through as they're trained, and also that the contact between a hairstylist and a client is somewhat more limited than the contact between a client who's receiving a massage and then the massage therapist. And so the difference, again, thinking about wanting to have a risk-based approach to what was opening in stage 1 and then what was opening in stage 2, those were some of the reasons that we looked at the differences between those multiple groups.
All right, we're just getting down to our last few questions because we've already been going for over an hour. And as you might imagine, the doctor and I have a lot of other stuff to attend to. Penny McFarland says fitness and facilities are a must for good mental health. How can a hair salon be considered a higher priority? Doctor?
Absolutely, and the choice of which businesses are in stage 1 versus stage 2 was not a comment on the relative value that the business provides. Absolutely, fitness, physical activity is essential for physical and mental health. Recognize that, and absolutely recognize that the closure of fitness facilities has had a significant impact on many Albertans. However, a fitness facility is a place where people go, obviously, when they're working out, they're breathing heavily, they're working hard, they're sweating. So the equipment that's used by multiple different people is a potential risk. And even though members, even before COVID, would be encouraged to clean equipment after they've used it and between uses, it can be challenging to make sure that all of that equipment is adequately cleaned between each person using it. Whereas in a hair salon, again, it has nothing to do with the relative value. It's about the risk of transmission. And in a hair salon, you can have a client come in if both the client and the hairdresser are masked, and there's a way of ensuring that clients are not sick, that the employees aren't sick when they're there, that it's easier to control and minimize or eliminate the risk of infection in those places than it is in a fitness facility. And again, looking forward to, if we're able to keep our infection rates flat, the fitness facilities, absolutely. We're looking for the day when those can open because they are important and absolutely recognize that.
All right, Emma Waselinchuk asks, is there any indication when the visitor restrictions will change in hospitals. Well, I do know, Emma, that there has been some, I guess you could say, relaxation of visitor restrictions in long-term care, continuing care nursing homes, to allow up to 2 people at the same time, as long as they're wearing appropriate personal protective equipment, et cetera. And we've also tried to make sure that hospices are aware that it's quite appropriate for them to allow visits, as long as there's a little complication for hospices that are in a hospital setting. But in terms of hospitals generally, Doctor?
Sure. So there have been some changes over time, and I know one of the concerns that we've heard a lot is that when someone's admitted to hospital who has cognitive impairment, so perhaps somebody who has dementia or someone who has a developmental disability, we've heard significant concerns from caregivers that the caregiver for that individual is a part of the care team, and that person who's admitted to hospital may not understand what's happening to them, and that the hospital team would not have the ability to care for that person and provide the support that they may need because they're
not already a visitor. They're not already a visitor. They're part of the care team.
And so we worked with Alberta Health Services to ensure that that's built into the visitor restriction list, so that those who are a part of the care team for that person, specifically the patients that have cognitive impairment or patients that have a developmental disability where it's challenging for them to understand what's going on, that those visitors are again not restricted anymore, and trying to adjust the visitor restrictions so that the patients get that whole support that they need, in addition to trying to limit the risk of introduction of virus into the facilities, as might happen if there were multiple visitors.
Thank you, Doctor. So we're going to take a couple more questions. Oak Darkling says, nothing ever mentioned about what Jason Kenney will do to help mental health social programs. Thank you, Oak. We didn't mention it tonight, but we have talked quite a bit about mental health social programs during the COVID crisis. And let me back up a step to say that one of the biggest initiatives taken by our government has been a historic investment in increasing access to mental health and addiction supports. So even at a time of real fiscal challenge, Alberta's government has invested in the past year an additional $150 million in mental health programs and addiction treatment programs as well, because the two are very much linked, of course. And then, and part of the latter, in terms of addictions, we've added 4,000 new spaces of addiction treatment and recovery spaces in the system. So then when we had the coronavirus pandemic, one of the first things we did was to say, look, people are going to be facing, many people, a real mental health challenge and crisis here. People who are locked up at home, or they've lost their jobs, or they're facing financial anxiety, and for so many other reasons. And so we stepped forward about 3 weeks ago with an additional $53 million in investment in mental health support. And I would ask our team to please post in the comments section below a link to the details of the announcement about the COVID-19 pandemic mental health supports that we made available. So Oak, this $53 million in support is more support for mental health in the COVID crisis than all 9 provinces outside of Alberta put together ×2. So we are doing far, far, far more than anywhere else in Canada to respond to the mental health needs. Of course, I'm sure it's never enough, but there are substantial additional mental health resources out there. And I want to thank you for asking the question. And by the way, just please also to our team, post the mental health helpline below. If you know of folks who are going through a hard time, maybe feelings of depression or serious anxiety, or worst of all, suicidal thoughts, please let them know that help is available. There are multiple different helplines out there, and we'll give you the Alberta Health Services mental health support helpline below. Paul sorry, I'm laughing just because the questions never seem to end, even though we're keep trying to wrap it up. What will schools look like in the fall? Will there be enough room for everyone if they still have to be safe distance? Will kids have to wear masks? Well, we haven't come up with all those details yet for the fall. Minister LaGrange, Minister of Education, did make a statement last week about the operation of education over the summer classes and the like. Do you have any thoughts on Pearl's question, Doctor?
One of the things that we're going to be doing, we're already doing, is looking at the experiences of other countries and other provinces that have opened their schools. And so we'll have the opportunity to learn from their experiences, to learn what are the kinds of things that help to keep kids safe, to keep teachers safe, and some of those questions about spacing and masking and all of those details are going to be coming forward as we look at those other provinces and learn from them. And I absolutely know that the school boards are wanting to make plans and that we need to be making some decisions and giving some guidance soon. But we also need to make sure that we're learning as the evidence is emerging about how we can safely open our schools. One thing I will say that will be different, not just in schools, but in all aspects of our lives, we really have to be very strict with ourselves, with our kids, that if we're feeling sick, we need to stay home. And that's going to be something that will be different in the fall from the typical approach, I would say, that most of us have, that if you have a little bit of a runny nose or a sore throat, most of us would feel that, you could just soldier on and be tough. But I will say that that's going to be something that we will have to get used to changing as we move forward in the near future.
All right, we're an hour and 20 minutes into this, so we've gone over time, but I'll take one last question from Chris Palmer. A gap in the guidance, our office towers, what's the guidance and plan to allow workers to return to these buildings? Well, I think the answer, Chris, is there's never been a public health order telling people they can't go to office work. There's been a general recommendation that if people can work from home during the height of the pandemic, they should try to do so. But I do know that many employers do want to phase back into full productivity and want to bring their workers back into their offices, and that is completely permissible. And we would just ask that, same comments, a lot of this comes down to common sense. We would ask any employer just to look at the general business guidelines available on our website at Alberta Biz Connect. And obviously, if it's an office tower and people are in kind of a bullpen setup, we would just ask them to make sure that they're appropriately spaced and there's additional hygiene, cleaning of surfaces and so, but there's no prohibition on working in office towers.
Yeah, that's absolutely correct.
All right. Well, that was a marathon session, but thank you all for the good questions. I know that there was probably been a couple of thousand questions we couldn't get to. Sometimes late at night, I will pick through some more of the questions online and try to respond in writing. I'll try to do that tonight. But we did want to give people some direct responses following today's announcement. Again, I would take this as positive news, folks. Tomorrow we begin phase 1, province-wide, including opening retail in Calgary and Brooks. There are just a few services that we're going to phase in over 10 to 14 days in those two cities because of much, much higher rates of infection than the rest of the province. But don't take that negatively for those two communities. I mean, I did the math, see if I have it here, Doctor, but for, I think Calgary, the number was, here we go. I don't have it here. I think the number was 79 active COVID cases per 100,000, and it's 29 cases province-wide by memory. And in Montreal, it's about 600 cases per 100,000 of active COVID cases. Mm-hmm. So Calgary is definitely, it's not a red light, it's more of like a yellow light right now for 10 to 14 days. It is about 1/10 the per capita incidence of confirmed COVID cases as they have over in Montreal. So we're doing much, much better, but we just don't want to, our public health folks just want to be doubly sure because they do have cases of untraceable, in a way, so I should say, cases of community transmission to sources of which they've not yet been able to identify. So there's that little question mark out there, which could lead to serious problems in the future. So giving our public health folks 10 to 14 days more before, 10 days for restaurants, pubs, and bars, and hair salons, and 14 days for limited worship services. It's just a little precaution. We've been through a lot over the past 7 or 8 weeks. Albertans should be so proud of themselves for what they've demonstrated. This is not a province where we need the government to tell people how to live their lives. This is a province where people get the concept of responsible exercise of personal freedom. And I want us to continue to lead the country in just that. We suspended far, far fewer areas of economic activity than other provinces, and yet we have done far, far better than Quebec and Ontario, for example, or most large population jurisdictions around the world. That wasn't because of government micromanagement. It was because of millions of Albertans doing what Alberta does, which is personal responsibility. And the whole deal now as we go forward is gradually phasing out of the relatively modest restrictions we put in place, as long as folks continue to show that personal responsibility. So let's continue to show Canada and the world. You know what? When the history of this, of all of this is done, I hope that we're going to be able to look back and say Alberta was one of the best places in the world in its pandemic response. Thank goodness for our common sense public servants who started ordering masks and protective equipment way back in December. They didn't need some international body to tell them to do it. They just did it because they heard about a strange illness emanating from China. Our testing people were way ahead of the curve. Our public health folks, led by Dr. Hinshaw, have done fantastic work. But most importantly, individual, everyday Albertans who have demonstrated, who have made sacrifices, who have acted responsibly. I believe in freedom, and that personal responsibility is the conditioned precedent of a free society. We'll be testing that in the weeks to come as we move through this gradual relaunch, all of us together. So thank you very much, Doctor, and thanks all for your good questions.